during COVID-19 and guidance for caregivers. I am delighted that we have a regional and national expert, Dr. Bela Sood, that will really be providing some timely insights regarding the topic. I am Adrienne Cole Johnson, Director of Family and Community Engagement, and just glad that you all are here with us this evening, and I'll be serving as our facilitator. So before I provide a proper introduction of Dr. Sood, I'd like to start with just some quick housekeeping details. First, I'll ask if everyone can mute their mics. We will start with just some conversation and dialogue that Dr. Bela Sood will just share from her experience, and then we will go into Q&A. The session will be recorded and placed on our website. The session that will be recorded is Dr. Bela Sood's presentation. We will not record the Q&A portion. We ask that everyone be courteous and respectful throughout the evening. And what you'll also see is a link that will be dropped in the chat. So if you can find your chat feature, if you're on the computer, it's likely at the top of your screen. If you're on the phone, it may be to the side or to the bottom. But there will be a link that you can fill out. So if you have a particular question that you'd like to share, something that you would like to get insight for from Dr. Bela Sood, we ask that you just sign up there and we can go from there. I will also say Dr. Bela Sood is very interactive. And so if you want to drop something in the chat, we will have staff who are paying attention. And as we can kind of weave those things into the conversation, we will. All right. So that's it for housekeeping. I really want to jump into introductions for our guest. As I mentioned earlier, Dr. Sood is just a regional and national leader in the work that she does. She's professor of psychiatry and pediatrics and was chair of child and adolescent psychiatry and training director of the Child Psychiatry Fellowship Program at VCU Health Systems. Her special interests are in the training of an adequate workforce in child mental health, reduction of stigma around mental health issues, outcomes research, mood disorders, and ADHD. She is specifically focused on ways of providing optimal mental health to the children of Virginia, focusing on innovation of technologies such as telemedicine to bring such care to rural areas of the state by integrating mental health, pediatrics, and primary care. Such a long list of accomplishments, and I would just like to read a few just to really show the depth of experience and expertise that Dr. Sood brings. She was appointed by Governor Kane as the mental health expert to the Blue Ribbon panel that investigated the Virginia Tech massacre of 2007. She's been on the best doctors list for Richmond and the US from 1996 and onward. In 2018, she was appointed by Governor Northam to the Governor's Working Group on Trauma-Informed Care to Children in the Commonwealth. And for the past 4 years, she's really focused efforts on prevention and child mental health, within which she's focusing her efforts in developing an attachment clinic at VCU Health Systems. I could go on and on and on, but I will stop there. Welcome, Dr. Sood.
Thank you. Thank you very much, Adrienne. I know Adrienne for a while in our previous lives.
Absolutely. And that's the truth. I've been a witness to the amazing work that Dr. Sood does, really in the community with students and families that need that additional support. So again, I'm beyond thrilled that you are here with us this evening, sharing a bit of what you've been learning and what you've been seeing during COVID-19. So I'll hand it off to you, Dr. Sood, to share a bit, and then we'll get into Q&A after that.
Okay, thank you very much, Adrienne. I think that May is Mental Health Awareness Month. And as we all know, there's no health without mental health. So it's really timely that we are talking about this. I think we all would agree that this last year has been surreal. Surreal in the sense that no one has ever experienced our lives as we have done. And I think that it has affected all of us in so many different ways and so many different levels. As a mother of 3 grown men and their families, I know that they themselves have, I myself as a family person, experienced this past year in a way which I had never ever imagined. It has left no country untouched. And we stand here, changed people. And I hope that we will remember this experience and use it to our benefit as we go along. But we all know that for children and families, this has been a gargantuan struggle because people have lost folks they have known. They've had a loss of friendships, loss of contact with people. Last year it was so poignant to see young people losing out on their graduation ceremonies. And I mean, adolescents were bereft with all of that. Young children were, they couldn't connect with anyone. And the fear, anxiety, social isolation, sadness was something that we all struggled with, trying to figure out, is this normal? Because the new normal is a very new normal for all of us. And there were some kids who really actually did quite well in the sense that the anxious kids and the introverted kids somehow, by avoiding, things that they were petrified of in their previous life, some of them really loved it. But by November, December, you began to see a spike of problems even within that group. Because as we all know, it's the human condition. We all crave connection of some sort or the other. And so COVID-19 really did a number on all of us. People couldn't meet their grandparents. The extended family did not work the same way. And so you don't need me to tell you what this experience has been like, but I just want to acknowledge that in some ways. And then we had the whole sort of Black Lives Matter, and I feel one would clearly call it a syndemic. It was a pandemic along with all of the things that were going on, which really brought forth for our communities the geographic inequities because of where we live, where we practice. All of those things came out into the forefront, and we began to see life in a very, very different ways. People lost employment. Children were picking up on their parents' distress. And as we all know, our work day has really increased monumentally. I know that my Zoom meetings in the evening now take up almost 5 days a week because people feel you have the time. And so also for mothers who are actually surveilling their kids' homeworks, they're doing their own work themselves, and teachers are kind of struggling to figure out how to best impart knowledge in this really virtual world. Certainly, kids, as I said, are very different. You might find one child who temperamentally just kind of feels that they take to this because they really, I have heard of a lot of people saying that grades have increased, and some other kids, it has been a monumental disaster. They just cannot hack it, and they have had significant trouble. So this really reflects how children are different. And so no kid is the same as the other one. And so you really cannot use a prototype to determine how kids are going to do. So you really have got to know your own child, and you've got to know what works for them, what doesn't, and really create a template for them which is specific to them. Little children are like, they're all around you. They want to be around you. They like to be around you. Teenagers, on the other hand, cannot stand the sight of parents sometimes. And sort of the being stuck at home and not being able to go out is developmentally something that you don't expect teenagers to do. So all of those things have been a major struggle for children and parents, as well as the school system. So it is very important for parents. I always advise folks to understand that their child is unique. It is very important that when kids express their feelings, that it is very important to acknowledge them. It's okay to have big bad feelings. It isn't a big bad event which has occurred. And so one should take those feelings, but know how to manage them. So this really provides a great opportunity and a platform for parents to really get to know their kids because we have time on our hands. And for the first time, we are not kind of running around rushed, although I think that momentum is again building up. But this is an opportunity for parents to really get a sense of what makes the child tick. You know your child's temperament, and you can find out what's bothering them, what is abnormal and what's not. Is this different from their baseline personality? Because that change is really your red flag. If it's a change from their baseline personality, you need to sit up and pay attention. Validating their feelings. You can't tell children you shouldn't be feeling this way. but really acknowledging them, validating them, and helping them accept the loss. There's no point in saying, oh, well, get over it, because kids have those big bad feelings, and just acknowledging it goes a long ways in making them feel less lost and heard, seen, and acknowledged. And so figuring out, and I'll talk about that just as I end, about things that parents can do to really make life much more predictable, retaining a schedule, because oftentimes we all know that you kind of do your Zoom meetings in your night clothes, and you eat at strange times, and no longer are the same codes that we were so used to, which really act like zeitgebers. They kind of determine how your day is going to go, and those are such important little anchor points in our lives, and we have lost those. And so it's very important to re-engage those as you go along in life. So that predictability is something that kids really crave and they need, and we must keep that in mind. However, I know that from my colleagues in pediatrics, the anxiety and depression are at an all-time high. About 60 to 80% of the children coming into these practices have expressed some sort of anxiety and depression. So I know that it's well and alive, and it's really increased. We do know that emergency room visits have declined for physical problems, but they have increased for mental health problems in the past year. And there is a significant increase in the need for finding mental health experts, which tells you that these types of difficulties, mental health issues, have really increased monumentally and exponentially. And if we don't recognize them, it's both a lost opportunity as well as the morbidity, meaning the side effects or the complications that occur when you don't recognize mental health issues, and the complications from them, including suicide, are increasing greatly. So what do parents kind of note in their children? Sometimes they are very isolated. They're kind of on screen time or gadgets or digital platforms exclusively, and they're ignoring what's going on at home. And basically, there is a lot of verbal and physical aggression, which is not normative, but nevertheless can occur. And sometimes they look very bored. Sometimes there's displaced frustration. So little tiny things can kind of send children into a cascade of anger that you had never seen before. But this is all part and parcel of this new normal that they have to deal with, because they don't have those anchor points which are there in their life. A lot of kids will end up becoming very oppositional. You can't make me. These are stupid chores. I don't want to do them. Fine, I'll only do it, but only for 5 minutes. And so you see that, versus kids who become very clingy and fearful. And so sometimes it's an exaggeration of baseline personalities, and sometimes it's the total opposite of what's gone on. But anytime these changes are occurring, it's a red flag. Anxiety is one of the major issues. And so I would like to kind of spend some time talking about that. So let's have a little bit of a conversation about what's part of what we saw in COVID, and what are true blue baseline problems with anxiety, which is a fairly common phenomenon. In fact, most of the studies show that if you look at mental health issues, anxiety is perhaps the most prevalent of the things that clinicians are find. So let me just kind of go over a couple of examples. There's little Addie. She's 3 years old, well-adjusted baby, good toddler, and mom thinks it's the time to really get her into daycare. The mom puts her into daycare, and to her surprise, things begin to really go south very quickly. Addie does not want to go to daycare. She really cries up a storm. She clings to her mom. On one occasion, she actually bit into her mom's arm because she was afraid of being left at school. So Addie, as you kind of look at her personality prior to that, at the age of 3, she is probably going through what is called normative separation anxiety. She has a tough time separating from her parent and does not know how to deal with it. And so is having temper tantrums whenever school comes up or daycare comes up as the issue. What I'm pointing out is that there are certain phases in children's lives where anxiety is a blip, which is normative, and we need to understand what that is and to acknowledge it and accept it. Stephen is a 6-year-old who's a well adjusted 5-year-old, really happy go lucky, no problems at all. And all of a sudden begins to develop this worry about nighttime. He's worried that there's a boogeyman, there's a monster in the closet. He's always kind of worried about, things sort of coming out of the woodwork at night and does not like to sleep alone. And mom and dad are really kind of puzzled what's going on. That's where we see classic increase in a normative anxiety blip, which parents get very worried about, but really is a phase. And if you can support your child through that phase, because it's that stage where they're learning that death is an irreversible phenomenon, that parents die, grandparents die, they're not going to come back, and it produces this existential fear in them, which comes up. And all parents need to do is to support them at that time. You don't need any medications. You don't need people like me. You need to just support them. And within a year or two, it kind of settles down as they begin to see life being predictable. Brianna is 12 years old and all of a sudden begins to really develop this fear that she's going to die. And she has these palpitations. She is afraid to go out. And as you begin to kind of listen to it, doesn't sound really normal from any stretch of the imagination. She feels like she's going to die. And certainly at that point, you need to have a conversation with the pediatrician because probably Brianna is experiencing a panic attack. So what I'm trying to point out is that there are phases and stages in children's lives where anxiety can be a very normal phenomena. And let's sort of take a look at our friend anxiety because we all have experienced it, right? We all have experienced anxiety in so many different ways. So common questions that come up are, is a small child going to experience anxiety the same way as perhaps a teenager or a 38-year-old? Is anxiety ever useful? And we know that sometimes anxiety is useful. So for example, as I was preparing to kind of talk to you guys, I had to give it some thought and I had to be a little anxious because the cortisol sort of increases in your body. You kind of sort of get ready for the event, and if you don't do that and you're kind of sort of laid back, you're probably not going to land it, right? So anxiety sometimes is pretty useful for all of us. We need it. Sometimes it's absolutely necessary. And when does it cross to the point where you have to seek the help of a pediatrician or a child psychiatrist or a counselor of some kind? It's kind of important to know what the threshold is. So I'll kind of walk you through some of that. And oftentimes with mental health, people feel like, when I acknowledge these things, am I crazy? And really, no. People have to begin to start looking at mental health issues as a part of a continuum, just like a headache is. Which headache are you going to treat with Tylenol? And which headache do you have to be worked up for a tumor or a seizure or things like that? So mental health issues, emotions, these are all on a continuum. We all have attention spans. We all have moods. We all have anxiety. At what point does it get converted into a thing where you need assistance? And really seeking assistance is a sign of strength because the quicker you get at things, the quicker you're going to overcome it, and the quicker you're going to really kind of master it so that it is not managing you, you're managing it. And certainly we know that COVID has done a number on all of us with anxiety and depression. So this year has been one where it has been a year of reckoning where people have had to kind of figure out, am I going to get through this or do I need assistance or help? So what are those things which require assistance and help, right? So I just kind of said we all feel anxious. There's certain things that we worry about. I worry about copperheads in my yard. I'm a gardener. I love the outdoors, but those things really give me the heebie-jeebies. I cannot get over my fear of snakes, and yet I encounter them regularly in my neighborhood and I still garden. So we've got to sort of figure out how frequent is that thing which is producing anxiety and how much can be avoided, right? So normal anxiety is adaptive. If I don't watch in my neighborhood where I'm going, I've had several encounters with copperheads. They're curled up in the middle of the street. And if I don't use if I go walking out at 8 o'clock when in winter, not winter, well, they're not out in the winter, but somewhere like this time of the year, and it's late night, I can be sure that that if I'm not anxious, I'm going to be stepping on one. So it's very important. On the other hand, if you're fearful of tarantulas and you're never going to visit the Amazon, you don't need to be anxious about that. You just know you have a phobia of it, but that is not frequent enough. That's not going to produce anxiety. If you're worried about, there are certain things that allow your body to get you ready to handle an impending threat that is there. And we all experience it at certain time. However, pathologic anxiety is when it becomes so excessive and it is way out of proportion to the event which is causing it, and it impairs your functionality. So it's stopping you from moving out of the home. Like if I decided that I can't really leave my home because that snake is going to be there, then I'm in trouble. And so it should not be to the point where it is stopping you from doing things. And that to me is one of the hallmarks of mental health issues which get in your way and you need assistance and help with. Yeah. So it's really important to understand that when it begins to functionally impair you and cause a decrement in the quality of your life, that's when you need to talk to your pediatrician and find out, do I need to be seen by someone, or can you take care of me, or at least give me an idea of what might be going on? So having said that, what are the types of anxiety disorders that we all experience? So this is Amy. She's 11 years old. She reveals she just does not feel good. She's scared of the outdoors, and she's a well-adjusted child before that, although she was a little clingy and underfoot even as a toddler. She kind of managed to do stuff, but at the age of 10, she began to show these things where she would begin to get very scared. She was embarrassed most of the time. She would blush a beetroot red each time she was in company, and she would feel like her heart was sort of jumping out of her chest. She had never been like this, and occasionally thought that she was going to die. So these are the types of children where you definitely want to start, talking to your pediatrician who knows you and your child from the time they were born, right? Because you have that relationship, and they can kind of really give you a good idea of what this is, what this could be. Yeah. So is anxiety really something that is a weakness that we just kind of come up with because we can't hack it? But studies show very clearly that there are areas of the brain which are impacted in anxiety, and these are the amygdala, the medial prefrontal cortex, and the hippocampus, which these are places where our memories get encoded. And each time something comes up in an environment which produces that reaction, off you go to the races, and you begin to feel the physical symptoms of anxiety. This is a great YouTube video which kind of talks about a good neuroanatomical, and it's really well done. So if anyone wants to, I can share these slides and you can take a look at it on your own time of how the neuroanatomy of anxiety is really something that indicates that these are neurobiological phenomena and really not a sign. This is how you're wired, and this is how your body reacts to these things. So there are so many anxiety disorders, and I won't kind of panic you with all of them, but this is a good way to kind of understand them. Specific phobias is my phobia of copperheads and anything which crawls. I don't like those, so that's my phobia. Some people are scared of jokers, or and those kinds of where I could never. Clowns, for example, are some people's phobias, and I can't understand that. But you have to put yourself in their shoes. Social anxiety disorder, panic disorder, generalized anxiety disorder. So let me just, rather than go over all of the slides, I'll kind of just very quickly go over phobia, which is a specific reaction to a specific thing, to which you have a major reaction in your body where you begin to feel what I've described, the palpitations, the feeling that you're going to die, that something terrible is going to happen if you're not removed from next to it. Social anxiety is where, when you are put in a group of people, you are acutely aware of your surroundings, you're acutely aware of them, and you just wish that you were not around those people. And we know all of those little shrinking violets, right? They don't want to be around people, and they will do everything to avoid social situations. These are young people where there's a little bit of performance anxiety too. They're never going to stand in front of the assembly or give a talk on anything. They'd rather die because they feel it. For them, it's like really a panic, which is what is the next one. Their panic disorders, it is a horrible feeling where your body really begins to feel like that you are not going to survive the next moment because your heart's beating, you cannot swallow anything. You're feeling like your hands are cold and clammy, that you're going to die. You feel like the walls are going to cave in on you. A little bit like what you feel in claustrophobia, if anyone's gone through that. And this is such a horrible feeling that when people have had one panic attack, they're so worried about it that they don't like to go out. And that's where you begin to see, I don't want to go out, which is what we call agoraphobia. And so if you don't handle the panic, you're going to have someone who is housebound. So that's where what panic does. Generalized anxiety disorder is where people cannot really make out what they're anxious about, but it's a free-floating anxiety. There's always an as if, what's going to happen if this, what's going to happen tomorrow, what's going to happen. There's this just a sense of foreboding. So there's nothing specific like the rattlesnake or the copperhead or the clown, but it is more a general. These are people who you call worrywarts. They're constantly worried about stuff. Sometimes there are very rare general medical conditions, such as a very active thyroid gland or a tumor on your adrenal gland called a pheochromocytoma, in which you see paroxysmal episodes of anxiety occurring, which you just can't figure out. And it's coming from a medical condition. Once that's taken care of, the anxiety dissipates. Sometimes you see anxiety with adolescents and older people, substance-induced anxiety, which is coming up because they are withdrawing from a substance. And that's something to always keep in the back of your mind. Obsessive-compulsive disorder is another special type of anxiety in which a person is obsessed with certain thoughts which are constantly intruding into their consciousness. And in order to get rid of the fear that obsession produces, they have to engage in compulsions. So if I don't clap my hands 3 times, or if I don't count in 3s, or if I don't count in 4s, something is going to happen to my mom. Okay, so it's that odd and bizarre, but that's the obsessive compulsive stuff, which is really coming from the way your brain is wired. And we know now that the caudate and the cingulum areas of the brain, which have to do with OCD, are the ones which are impacted in a biological level. Post-traumatic stress disorder is not considered any longer an anxiety disorder, but I kind of always put it there because it's a reaction to a traumatic event which has occurred in a person's life, which is so enormously impactful that the person ends up having what feels like a panic disorder or a dissociation, like I can't be here, or I can't go here because it reminds me of that, or they might have nightmares about XYZ. And it becomes really a very difficult thing for people to overcome unless they get proper treatment, like EMDR or some sort of counseling, which can help them de-link the traumatic event from the way the body reacts to these types of things. So this, in short, are all of the different anxiety disorders that we have. And I have this entire sort of talk, which I thought I would kind of go into, but I'm not going to go into because it obviously will take ages. But these are some of the things, like people have phobias against having their blood drawn. They have to be put under general anesthesia. Some people have fear of heights. Some people have all kinds of phobias are there. So most of these things are treated with what we call systematic desensitization or therapies of different kinds. In fact, anxiety is one of those areas where we find that non-medication based treatments can be as effective as this type of counseling, which is called systematic desensitization. Very quickly, systematic desensitization is like, say, for example, my own phobia about copperheads. These poor copperheads in my yard probably have their ears burning here. But anyway, so I have to first, my therapist would take me through just an image of the copperhead and allow me to think that I'm touching it. And then gradually get to the point where I actually see a copperhead. and I'm able to deal with it. So it's a slow progression of setting up a paradigm within which a therapist takes you step by step by step, so that it does not produce the same type of terror in you, and you kind of learn how to master that anxiety as you go along. So that is systematic desensitization, and kind of goes is really based upon learning theory and behavioral management of these things. So we talked about social anxiety. So in this, the anxiety is out of proportion to the actual threat posed by the situation. And many of these individuals have, when they look at their brains, they have a very marked response to something which they see as even which are threats which are not intended. So they are misperceiving things in a big way, and their brain is responding to it by really getting aroused. And so we do see these biological elements in these young folks. Okay. I find that when you do cognitive behavioral therapy, which is the type of therapy you require for this, and along with the other behavior therapies, that the brain actually reverts back. It kind of changes and it calms down. So we do see biological reasons why these therapies are so effective in dealing with it. When we use medications, these are things like antidepressants, selective serotonin reuptake inhibitors, and other medications which are Cymbalta or Effexor, which kind of fill back those neurotransmitters which are responsible for not allowing you to go through the anxiety experience without losing it, right? So these medications calm that threshold down so that you don't respond to every stress that you see around you by really losing your ability to understand what is actually your surroundings. Panic disorder is, these are all the things, and you can imagine anyone going through these. If I had this, boy, I would feel very threatened, because these are huge, big symptoms. And you really begin to feel like you're going to die. So this fear of dying is what leads to people not wanting to leave their home. And they're very effective treatments for panic attacks. In fact, treating anxiety is one of my favorite things, because you really do see such great response to treatment. Panic disordered people end up with a lot of major depression because they feel like they can't live their life. And that is why it's so important to do the treatment as quickly as possible, so that secondary depression does not develop. And these individuals end up using alcohol to quell the anxiety. So that's why it's so important to treat it before you kind of move into this. Talked about agoraphobia, generalized anxiety disorder. As I said, it's the worry wart. Things just out of the blue just kind of worry you. You're always sort of anticipating something bad about to happen. And that's not a good way to live, right? So help is there. It needs to be treated. And so now we come into OCD, body dysmorphic disorder, which was what apparently, Michael Jackson had. And he sort of, you could see how he was not comfortable with the way his body was. It's considered an anxiety disorder. Trichotillomania, that is pulling your eyelashes out, pulling your hair out, it is felt to be a type of anxiety disorder. Excoriation is pulling at your skin because you feel like there's something there. And so that is also felt to be anxiety. You all know of Monk, and he is our OCD guy. And these are very difficult illnesses to treat, but they can be treated. Talked about PTSD. In PTSD, you do see all of these types of problems which emerge, where there are intrusive memories of the event. You try and avoid the place. You have dissociative reactions, and you generally try to sort of get away from anything that reminds you of the traumatic event. And so you can imagine how it is so, it really gets in the way. So I think I have kind of talked to you a lot about all of the different types of anxiety disorders, and there's so many of them, but there's very good evidence-based treatments, particularly the psychosocial treatments like cognitive behavioral therapy, systematic desensitization, and then of course the medication aspect of it. So having said that, let's take a look at you as parents and caregivers. When you have children who are experiencing all of these problems, we have to begin to look at ourselves as to how our child's problems, as well as what COVID has done to all of us in our own lives, because it has left no one, unscathed. We have to look inwards and we have to acknowledge our own feelings. And remember the adage when you had long time ago when we all traveled by air, they always said, put on your own oxygen mask before you put it on your child, right? So it's really important for you to be feeling good about yourself. Take the time to process your own feelings, the things that you have lost, the things that are making you upset, and begin to start looking at alternatives than your previous life, like things like meditation. I have found that really helpful for myself. Exercising, I've started kind of walking 10,000 steps a day and lost some weight, but it's really been my go-to thing these days. Phone calls with friends, just pick up the phone and connect with them because you can't see them, and everyone commiserates with you because they're in the same boat. So it's not like they're seeing you're ignoring them, but you're forming your link. And and our
I know.
okay.
Hey, I connected with Tara. It was so odd. Everything's odd.
So I think
So
I'm having some.
I tried to call her and she didn't answer, and she said she was in a Dell district meeting. And I said, okay, well, if you can call me by 6, that'd be great. Before 6, I said I have a meeting.
Give me one second, Dr. Sood. I'm trying to see what we can do.
I'm having some competition there.
Okay, there we go.
Okay.
We're good.
Okay. Very good. So as I said, really kind of beginning. If you begin to take care of yourself, you will begin to be a better advocate as well as a friend to your child's mental health. And that is so important to understand that if you don't take care of yourself, you're not gonna, be a help for your child. Really developing a routine, because as I said, routines have gone for a 6, and it's so important to kind of just treat it like a regular life, and that you have to develop a way to kind of where to do schoolwork, where to relax, fresh air, reducing digital time because they're already doing Zoom and virtual learning so much that you have to put a stop to it. In fact, really have to kind of have some outdoor time and make them get involved in some minor chores. Play a board game. Charades is a great game. I love it. And or develop some new hobbies there. So there are lots of things that you could do. They might not want to spend too much time with you, but you could make whatever time you're spending with them really changed and refreshing, and really develop that bond and friendship in a different way. So you are what your children really model their behavior on. So because if you become anxious, they're going to become anxious. They're really watching you very, very carefully, and they're looking to you for guidance, support, and you are the guardrails. Yet you provide them the unconditional love, but you have to provide them structure too. The best parenting is the most boring parenting. You don't have to find something exciting to do every day. You have to be predictable. You have to be consistent. I always find when you are a boring parent, you're the best parent, because now you're kind of giving children what they essentially need, which is consistency, while taking care of your own emotional health by really reflecting on your own strengths and blind spots, what you do well, what you don't do well, and then be the best version of yourself to guide your children. Embrace your kids' strengths, and you know them the best, and you have to tailor your approach to fit their temperamental styles, because you can't make children do things which are not like themselves, and you have to be proud of them in some ways. Using technology, and I really feel like this has given me an opportunity to know my neighbors like I have never known them for the last 33 years. I have learned to enjoy my neighborhood in a way which I had never seen, the trees of dogwoods and the crab apples and all of the beauty of nature, which I had never seen before, because now I have time on my hand. And I actually know my names, and I've been to their homes, and we've had parties in my backyard, and with one or two people, and it's been wonderful. They actually got to know my dog, and I know their dog, and my dog is he's the bonding sort of glue. So really being different. It's a different world, but really looking at it as an opportunity for really capitalizing on things which we never capitalized on. Teaching your children to write cards again, texting friends, learning new skills, gardening, music, things that you're really bad at is a good thing to get to, because studies show that the baseline from where you start, the increment in improvement is huge, and that does a great deal for your self-esteem and so on and so forth. So if you're a horrible singer, music may be something that you really want to do because it kind of really helps you. So these are some of the things that very quickly I wanted to kind of point out, and then I would like to kind of open up the floor for discussion because I know we are sort of quickly running out of time. Yeah.
Dr. Sood, this was amazing. And if you don't mind, you can stop sharing your screen so we can see you a little bit more full screen. But I think what I love about your work, I know you live in these very complex health systems, and your ability to kind of break all of that down for us to even understand a bit more, and to understand some of the work that goes behind some of the really intense, mental health areas that you live, is great. So thank you. Thank you so much for that. For folks who are here and watching, we do have some more moments just to have Q&A, to take some questions from the audience. I know none have been submitted yet, but I will get us started, Dr. Sood, just with a few things. I know I was listening and taking a few notes of myself, honestly being a mom, and as I'm hearing you talk, some things that I've seen happen at home. But I know one thing that we've heard from parents